Ooh. Okay, give me just a moment. My notifications are going out. I'm going live on Instagram as well. Okay, so if you are just joining into the session and you have any questions for me, feel free to go ahead and drop it in the chat section. This is my first time going live on YouTube. Hi, Instagram. So, Instagram, if you're over on Instagram and you want to join me over on YouTube, feel free to hop over onto YouTube and join me for a live Q&A session. I've been getting a lot of questions during the holidays and everything has absolutely been getting buried. So if there has ever been a question that you have asked me either in my comments, especially in my DMs, that you want some feedback on, now would be the time to ask me those questions while you have me live. Because if you're asking me questions in the comments, if you're asking me questions in the DMs, I probably will not see it for like a week or something like that. So every now and then I like to come on live to answer you guys' questions live. If you guys are wondering why I'm looking in two different areas, that's because I'm live on both Instagram and YouTube at the same time. Hi, L'Oreal. So if you have YouTube and you want to come hang out with us over here on YouTube, Instagram, you guys can hop over here on YouTube. So let's see. Remember, you guys, I said YouTube is new for me. I don't see that there's like a question box at the bobble. I said the bobble at the bottom. So on YouTube, if there's a question that you have for me, you're just going to have to drop it in the chat and I'll see it there. Hi, Jamaica. Thank you so much. And if you're on Instagram and you ask me a question over here, you can drop it in the question bubble and I'll see it there. And remember, you guys can hop over here onto YouTube as well. I'm testing things out to see where people like to hang out more. Do you guys prefer to hang out with me over here on Instagram or do you prefer to be over here on YouTube? Hi. Hi, Yolanda. Hi, Sabrina. Hi, you guys. You guys, 2025 is upon us. Can you believe it? It's about to be 2025. I just knew we'd be flying around in cars, but instead, Elon gave us Tesla bots. That's what he gave us. You guys, if you're just chiming in over here on YouTube, if you're just chiming in with me, if there's any questions that you have, anything, there's nothing off limits. You can drop your question right there in the chat. Hi, Kiana. Tony, you said, hello, do you know of any refresher courses for the CCS? I have not coded in about 10 years and would like to get back in healthcare coding. I don't know of any refresher courses, but I do recommend the Qualified. You can find her on LinkedIn. I'm not sure if she's over here on Instagram. I don't think she spends the majority of her time over here on Instagram. But if you go over onto LinkedIn and look for the Qualified, check to see if she has any refresher courses. Hello, hello. All right, you guys, YouTube, don't be shy. Don't be shy. You guys haven't asked me anything in the chat. And I'm going to tell you how you know you should be asking me a question right now if you're on this live, either on Instagram or on YouTube. If you have been working in the healthcare industry for longer than 5 years, right? And you are uncertified and don't have a degree, right? So we fall in that category. Or if you're someone who has a degree, or if you're someone who does have a certification and remember about 5 years of experience, and you are not already making like past $35 an hour, If you have not made it past there, my friend, you need to be up in here asking me some questions. Okay. What the question box shouldn't be empty. Okay. You should be asking me some questions about what it is that you need to do, what your next move needs to be. Okay. We have inflation going on. We're about to be up under a new administration, under the Trump administration. Okay. And he's not playing games with anybody. He's not playing games with anybody. Okay. Especially a lot of these government programs that are about to disappear. Okay. Okay. Yolanda, you said, do you do career counseling direction if I'm already in the coding field? Yes, I do. L'Oreal, you said instead we down here paying bills. uh, Yolanda, yes, I do. I do. I do offer career counseling. Ah, L'Oreal said, Valerie knows her stuff. She helped me. Thank you. I see Margarita in there. Hi, Margarita. How are you? How are you, Margarita? I just saw Margarita jumped in on the chat on Instagram, you guys. She is one of my clients who worked in the coding field. If I'm not mistaken, she went from about like, oh, I ain't gonna throw all your numbers out there, but she had a pretty significant salary increase using the Rocket Resume methods. I want to say upwards of like 50 grand. I'll let her speak her own piece in there. I won't throw out her exact numbers. Hi, Tony. All right. YouTube, you guys. I still don't see any questions down there in the chat. Instagram is, they dropping questions down here. Okay, Jamaica hopped over. And for those of you over here on Instagram, if you want to hop over here onto YouTube and join us over here, you can. Jamaica, you said, what role did you like better as an individual contributor or management? Definitely individual contributor. You guys, I did not like management. I have no desire to work in management. I don't want to be anybody's supervisor, manager, director, VP. I did management for about 7 years when I worked inside of the home healthcare industry, and it wasn't necessarily like home healthcare or the company that I was working for. It just did not go well with my personality type. I personally do not like being in leadership roles. Okay, because I take my job very seriously, and if somebody's not doing what I say for them to do, it really irks my nerve. I would not be the manager that you want to have. Okay. Even with my clients with career coaching, if they're not following through on something that I say for them to do or following my established guidelines and procedures, I'm gonna call you out on it. Okay, I'm gonna call you out on it right in the middle when you trying to say something to me, and the way my systems are all set up, and I can go in my system and see what you are or not doing. I'm gonna call you out on it. Let's see. You said, hi, Val. My organization is going to Epic. My question is, what are the steps that I can do now to possibly be put in a position when those roles open up? Make sure that you are going into the Epic user web at the organization where you're working for. And then if you guys do not already have an Epic super user in your department, ask if you can become the super user in the department. Like that's like a clear gateway into becoming an Epic analyst and becoming certified, because they need Epic super users. So make sure that you're taking advantage of the free courses and resources that you can use in the Epic user web. Now, you cannot register for any of the courses that you see in there, and you're inside of my masterclass. So when you go into the Epic modules inside of the masterclass where I show you guys where to find all this information, remember, do not register for any of the courses that you see in there. Because if you register for a course that you see to become an Epic analyst, they're going to send it directly to the IT manager. They're going to send it directly to the IT manager with an invoice asking for them to pay for what you registered for. Do not do that. Okay. Take advantage of everything that's in there that is public access for Epic end users. If you guys do not already have a super user for your department, ask your manager if it's possible for you to become the Epic super user. Okay. And you can email me as well. Okay. Make sure you email me. Okay. Let me come over. I'm going to switch from Instagram over here to YouTube. Jamaica laughing at me. Sabrina, you said, I have to make sure I follow your YouTube page also. What positions should we look for those type of high income salary increases? You said you only have 5 years of experience and you also have the CPC. So it's important to note, you guys, that there are many different career paths in the healthcare industry that are lucrative. It's not just healthcare IT. Okay. So healthcare IT, medical billing, medical coding, revenue cycle, revenue integrity, compliance, all of these areas, data analytics, all of these areas are lucrative career paths. The only one that I would say is probably not, as lucrative, I personally would say, is release of information. Release of information. But all of the others are lucrative. Now, as far as exactly what you should be doing, that would depend on your background and work history over these past 5 years that you've worked inside of the healthcare industry. Okay, so tell me, like, what are some job titles that you've held? What I will say, as a medical coder, at some point, you should pivot out into revenue cycle and revenue integrity. Medical coders, medical billers, nurses, like we love you guys in revenue cycle and revenue integrity when you pivot over. So at some point, it's time to pivot out of that, especially if you're getting tired of working in a productivity driven environment and you want to get away from that. Look at rev cycle and rev integrity. Jamaica, wait a minute. Your message is getting tied in with somebody else. Oh, Jamaica is talking to Tammy, I think. Okay, I think that's what you're doing. You said, hello, Tammy here. What would be the best route to get into the field with 8 years of customer service positions? I went to school for billing and coding and received my CCA with AHIMA. You could do billing or you can do coding, either or. What I would not recommend is for you to do both, right? When I see positions that say medical billing and coding, to me, that's like a red flag, because those are two distinct positions. And if you are doing both, more than likely, you're probably going to be stressed out in the position that you're performing in. And this company, they might even be like maybe like a small organization or something, and they're trying to combine the two into one to save them a little coin. But I would not recommend doing it. And anyone who's a coder and anyone who's a biller could speak on that themselves, that those are two different positions. And also, depending on like the volume, you do not want to do these two things together. So it's good to know how to do billing and coding, but what I recommend to do a position that requires for you to do both the billing and coding. And if it's like a medical practice that has like a lot of patients, I would not recommend it, because you're going to be stressed out. So you can pick one or the other. And there are companies that will hire you with the CCA as a recent graduate with little to no work experience. There are companies that will hire you in those kind of roles. They got to pick which one. You got to see which one it is that you really want to do. Let me look over here to Instagram real quick. Thrill of Life, you said, which area do you think AI will affect the field of HIM the most? I believe that it's going to affect all of our front end positions. Everyone who's working in patient scheduling, insurance verification, prior authorization, collecting the co-pays, everything on the front end, it's really going to affect our folks on the front end. We're going to see eventually these jobs begin to phase out more and more and more. We're already seeing this happening when we go to see our providers, right? I'm pretty sure there's someone on the live right now that the last time you went to the doctor, you checked in at a kiosk, or you checked in on an iPad. You didn't necessarily really have to interact with the person at the front as much, right? Front offices or the office, they may just need like one person to be in the front, if anyone at all, they're getting to a point now where you can do all of your pre-registration and all this stuff before you even, check in or see your provider for your office visit. They're texting you and emailing you to make sure that you've completed everything before you come in for the office visit, right? And so, I mean, I'm doing my guesstimate on my forecast of how long it's going to take for this to phase out. I'd say like within the next like 10 years, we're probably not going to see our front office folks anymore. But not to worry, you guys. I don't want anybody to panic who's currently working in the front end of the revenue cycle. And remember, you guys, if you're working on the front end, you guys are like some of our most important team members in staff to the whole overall revenue cycle. Like I remember when I worked in the front end of the revenue cycle and feeling like my job really wasn't important, but it's like if it's junk in, it's junk out. And what goes wrong on the front end with patient registration and scheduling and prior authorization, oh my goodness, when things go wrong on the front end, it is a dominoes effect, and it affects everybody else, from our providers to the billing department, our coders, revenue cycle, revenue integrity, our claims. Like it affects everybody when things go wrong on the front end. So you guys have some very valuable skills that you can take with you into middle revenue cycle roles and back end revenue cycle roles. So it's not just like, you're stuck, these jobs are going to disappear and there's nothing that you can do. You could just simply work on your exit strategy to begin pivoting out into middle and back end revenue cycle roles. This is why I'm saying this to you guys. Things are happening right in front of our face. And I don't want people to look up one day or to get an email, to get called into an office to find out that your position is being eliminated because you're being replaced with AI. Do I think that this is going to happen with coding? No. Do I think that this is going to happen with billing? No. Do I think this is going to happen with rev cycle and revenue integrity? No, because there's always going to need to be like a human component there due to compliance. Things still go wrong. But on the front end, when it comes to our registration folks, those positions are going to begin to disappear. And there's also a lot of turnover in our front end positions, and not necessarily for a bad reason. These are entry level roles and positions. So at some point you do expect for your folks on the front end and entry level roles to pursue new job opportunities. So eventually these people, they do leave these positions. So there's a high turnover rate. So looking at it from a company's perspective, it's like, because it costs companies a lot of money to, fill roles and get people hired in and whatnot. Why have to go through all of that when we can just, implement this system that can take care of all of this for us? We don't have to do the training, hiring, and paying people, salaries and benefits or whatnot. We could cut all of that out and just, have the system to do it and have people do their own registrations basically by, sending them this link or giving them this kiosk when they walk in and they complete it themselves, right? So to answer that question, thrill of life, it's going to be the front end of the revenue cycle, but you guys have time to pivot out into the middle cycle, the middle revenue cycle, and then the back end of the revenue cycle as well. Okay. Shirley, you said, I've worked as an independent contractor as a CNA for quite a few years, and I'm currently 4 credits from receiving my degree in healthcare administration. Excuse me, you said, how can I get my foot in the door? So your time as a CNA, what I would want for you to do, or to tell me, is to focus on what medical practices you have worked in as a CNA, right? You may know the inner workings of working in a particular department. So let's just say you've worked in the cardiology practice as a CNA. I'm pretty sure you know some things from a clinical standpoint as well as an administrative standpoint as far as the inner working of the office and the way things should flow. So if you are pivoting or into healthcare administration or health information management, I would specifically look for health information management or healthcare administration opportunities in the cardiology space, because you want to look for job opportunities where the hiring manager is going to see value in what it is that you have to offer. So I wouldn't want you to just be looking for job opportunities any and everywhere, right? Looking in the emergency room and, neurosurgery, neurology, and pediatrics. I would want you to focus on cardiology. That doesn't mean that you have to stay there for your entire career, but you can use it as your entry strategy. The different challenges and nuances of working in the cardiology department. And remember, I'm just using that as an example because I don't know where you've worked, but the different nuances of challenges of working in the cardiology department. And there are some transferable skills that you can leverage to pivot into these positions. Now, of course, what I'm saying is easier said than done, right? Because you also have to have a resume that is working for you. A lot of people say that they're having a hard time scaling in their careers and getting selected for interviews and getting job offers. But when I look at their resumes, right, because they don't say anything about their resume, they just say that they've been applying for different job opportunities and not getting selected for interviews. And then I'm like, well, let me, look at your resume. And I look at their resume and I'm like, you mentioned nothing about the condition of your resume. And your resume is extremely important. Think about, and I tell you guys all the time, think of yourself as a business, right? If you are a business and you are trying to obtain funding for, something that you're trying to do in your business, and you go to the bank and they're like, okay, so what's your business plan? And you show them something that, let's just say, is not well put together. That's not a compelling argument to why you are asking for this. Do you think the bank is really going to give you the money that you're asking for? It's like, wait a minute, you're so passionate about wanting to scale in your business and you want X, Y, and Z, and this is the business plan that you wrote and actually submitted to us? Like, no, right? Your resume is not your career plan, but it is your short career story about who you are and the things that you say inside of your resume, right? So not just knowing what keywords you should use inside of your resume, but you should speak to the pain points and challenges of working in the positions that you are trying to obtain. You just can't just say any and everything in your resume. Some people are really not putting effort into their resume, and that is the real reason why you're not getting selected for an interview. When the hiring manager is reading your resume, you want them to feel like this person is going in the pile of people we're calling in for an interview. Not like you didn't care about the position you were applying for. You just, submitted anything, right? So that matters. Let me come over here to Instagram. I don't see what this says the name is. It says C4_21. You said, hi, Val. I have an interview coming up on December 2nd for an EMR content specialist role. Do you have any advice or pointers on how to prepare for the interview, please? Thank you so much. Ooh. If anybody ever received my free interview prep guide from attending my free masterclass, or anyone who actually has my interview prep masterclass, you know that it's a lot of information that I have inside of that masterclass. It's kind of a lot to even begin to tell you right here. So I'm going to kind of give you the gist of it. When you are preparing for an interview, one, I hope you've already figured out your salary amount. When you get selected for an interview, that is the point when the salary negotiation or your salary research time period starts at that moment. Okay, you don't want to be in the interview and they ask you, well, how much it is that you want, and you just throw out a random number. Okay, some people are leaving a lot of money on the table because they don't know and understand their market value. But to get to the question, give you a little tidbit of what you can do. And everybody here, when you get selected for an interview, one, let me go back a step. When you are submitting applications, make sure that you are keeping track of the positions that you've submitted an application for and what it said inside of the job description, okay? Because some of the things that's listed inside of the job description, they pretty much want to know, do you have the ability to execute out on these duties that's listed here? You want to make sure that you have examples that you can provide in the interview that matches to that. Now, I wouldn't want you to create an example for every single bullet point. Let's say you apply for a position and there was like 15 bullet points. You don't necessarily have to create an example for each one of the 15 bullet points. If you can, great. If not, it's not the end of the world. I want you to focus on the ones where you can create or give a full story full detailed background about what it is that you did that matches with that particular bullet point. And you don't have to answer the question in the interview telling them that you are providing an example that's listed in the job description, that that's what you're giving your response based off of. But just know that at the end of the day, they want to make sure that you can perform and execute out on the duties that's listed inside of the job description. If you got selected for an interview, congratulations, right? One, your resume worked because it made it through the ATS system. Two, your resume also worked for the second audience, which is humans. You guys hear me say this a lot. The second audience is humans, hiring managers and recruiters. It was compelling enough to get them to call you in for an interview. So you already know that you have something that they want. Now, when you get to the interview, it's time to seal the deal. It's time to give them detailed examples of things that you did that aligns to the bullet points that's listed inside of the job description. Okay, so that's like a short, quick, quick to the point, how you can prepare for the interview. Make sure you have your introduction together. Okay, that's usually the part that I want to say people are most nervous about, is not knowing how you really want to introduce yourself or whatnot. But if you have your initial pitch and introduction together in an interview, that helps to get rid of the nerves a bit. Okay, I'm coming over here to YouTube. Huh. Oh, you said it's another Shamika in the chat. Shamika, you said, what would you recommend for someone who would like to become an RHIT remotely with no experience? What would I recommend as far as what positions to pursue? You could pretty much pursue anything. RHIT and RHIA are two certifications that I really love the most. It could be biased because I am an RHIT, but I have a reason why I love the RHIT certification, and I feel like it's like the Jack or Jill of all trades certification. You can get that certification and do multiple things with it. You're not like in a box. So if you want to do billing, you could do billing. If you want to do coding, you can do coding. If you want to do revenue cycle or revenue integrity, data analytics, health IT, you can, right? What I do recommend is to go after positions that match well with your personality type. This is something that I like to tell my career coaching clients. Is one of the first things that I make them do is take a personality assessment, because the goal is to ultimately scale in your career. And if you are working in a position that you don't truly enjoy, to your core, then it's going to be a bit hard to scale, because you don't really enjoy what it is that you're doing. And that's how I felt when I was in the management position. I am very introverted. I know it may not seem like that, but I'm very introverted. My personality type is an ISTJ, and constant human interaction, like face to face, like all the time, and having to lead meetings and all this stuff, like I just did not enjoy it. I had a team of about 12, a staff of like 300 clinicians that included home health aides, nurses, speech therapists, occupational therapists, social workers, board meetings, having to go down to the DC Department of Healthcare Finance for the big meetings. I mean, it drained me. Okay. It drained me. And I didn't enjoy what I was doing. So I had to get out of it. And so my personal goal was to become an auditor, because I knew that I wanted to make a great income, but I also did not want to be anybody's manager. So if that sounds like you, if you're somebody where you're like, I want to make a great income, but I don't necessarily want to be anybody's manager, then analysts and auditor roles are the roles that you should go for. In those roles, you can make a great income. Fly Girl Bree Bree, you said, I want to get into medical coding. The community college only teaches outpatient. How would I branch out into both inpatient and outpatient eventually? I wonder why they only do outpatient and not inpatient. In order to get both, you're going to have to find a program that teaches you the inpatient side. I would, recommend a company that would be teaching you both, right? And you want to make sure that it is an AHEMA or AAPC accredited program. And if anybody is interested in becoming a medical biller, definitely check out Ask the Biller on Instagram. She's also on YouTube, also on LinkedIn. Okay. She shared her personal story with me. She actually was on my podcast before, you guys. And yeah, medical billing is definitely a career path where you can make a six-figure income. So definitely check out her. Okay. LJ, you said, how can we get Epic end user training outside of a facility until we find a job in the healthcare facility? I worked some time back in small offices and we performed several roles then. So the only way to get Epic training, you guys, the only way you can get Epic training and become Epic certified is if one, you work for Epic directly. You obtain employment with Epic directly. Two, you get hired into a health IT position at a healthcare organization that utilizes the Epic EHR software. Okay. So just because, so if you're just like someone who, let's just say you are a patient registrar and you use the Epic EHR system on a daily basis, that does not qualify you to get Epic end user training or to become an Epic analyst, because there's nothing that you do on a day-to-day basis that requires for you to become an Epic analyst. Right. Another way is if you get hired in with a consulting agency, a consulting company that has a contract with a hospital that uses Epic. And again, it's also a health IT position. Okay. Epic certification is a health IT certification, not to be confused with medical coding, because I see this a lot where quite a few people confuse medical coding and health IT as the same. And I think it's because with information technology, there could be like some coding involved, but technical coding, not medical coding, is like totally different. Okay. So these are two different things. I just want to put that out there. So to answer your question, LJ, the only way you can get Epic end user training is if you were hired into a health IT position with a company that is using the EHR system that requires for you to get that training and become an analyst. That's the only way. There are no outside training programs anywhere outside of that. And if you come across a company that says that they are providing Epic end user training, or that they can sponsor your Epic certification, and it's not Epic themselves and it's not a hospital themselves, you're working in a health IT position, run. Okay. Run. Let me come over here. AZ Lux Jewel, you said, I've been in the hospital for 14 years and I have an MBA. Any advice to move up? What position are you currently working in? You guys, it's actually really simple. Sometimes to just move up. It's just a matter of putting yourself out there and applying for the next job opportunity. That's the next level up in your career. One of the things that I talked about on my YouTube channel not too long ago was not staying in roles too long, especially after you've like mastered them. If you've worked in a position, let's say for like a year or two, and you have the ability to train someone else, if somebody new started working at the organization and you would be able to train them from A to Z how to do exactly what it is that you're doing with no guidance or anything like that, and you can train the next person how to perform in your position, you've mastered that position. And it's time for you to move on, especially if there's another level up, right? If there's something else that you can be doing that's the next level up and you could be making more money, there's your sign right there. The only person that can hold you back is yourself, not the company that you're working for, not your manager. Like, you are the only person that can hold yourself back. So if you've mastered a role, it's time to move up to the next position. And it's extremely important to do this at the very beginning of your career. I do encourage my clients to aggressively climb the career ladder, both professionally and financially, especially at the beginning of your career. And the reason why I'm such a big advocate for it is because that is one of the biggest mistakes that I personally made. And I want to make sure that nobody else does the same thing. I claim that to be my $100,000 mistake. In the beginning of my career, I wanted to be more loyal to the company that I was working for and thinking that I would just scale with this company and grow quickly. But no, that was actually the slow way to grow. professionally and financially. I was only getting a dollar pay raise, 3.5% pay rate. Like that's all I was getting. But if I was aggressively scaling up in my career into new positions at different organizations, if it had to take different organizations, I would have been reached the six-figure compensation range. But because I didn't do that, because I was more loyal to a company that I was working for and thinking like, oh, I could stay here, and retire here. It's a part of the reason why it took me much longer to get where I wanted to be financially. Right. So, with 14 years of experience and a master's degree, I'm not sure exactly what your title is or what it is that you're doing, but I would imagine that you're already making six figures plus. And if not, there's a plan of action that you can put into place to get there. I try to remind you guys about that as well, when I say that, because I'm like, I don't want to beat anybody up, but I do want to let you know, like, hey, like this is where you currently are and you can get out of it. You can get out of it. You're not stuck. Okay. Let's come over here. Yeah. Wait a minute. The perfect fan 85. He said, I have an RHIA and I've been in the healthcare industry for 10 years, but did not get my CCS. And I have a CBC. What should I do? There really isn't much more that you need to do. You already have 10 years of experience, which is equivalent to a master's degree. And for those of you who are not aware of the equivalent to years of work experience to degrees, if you've worked in the side of the healthcare industry for 2 years, and you don't have a degree, that's equivalent to an associate's degree. If you've worked for 4 years and you don't have a degree, that's equivalent to a bachelor's degree. And if you worked for 6 years plus, that's equivalent to a master's degree. And you will be surprised at how many companies are interested in experience over degrees and experience over certifications. And when I say this, I want to be crystal clear here. When I say this, when you guys see me talk about that in my emails and my social media content, I'm not saying that as a way to avoid degrees and certifications. I do believe that me getting my associate's degree in health information technology and the RHIT certification did make me more marketable and did help me to earn more money. Okay. So if you have years of work experience, if you do decide to add on degrees and certifications, you're increasing your market value. I've said this in my emails. I've talked about this inside of my social media content. And it's important for you to know what your market value is. You are a business. You are a business. You are a business. I want everybody to say it with me. Say, I am a business. You should know what your market value is in the healthcare industry, whatever it is that you do. You should know what your market value is depending on what state it is that you're working in. Do you not think that, let me see, what I got on my desk over here? I got a candle going. Tuscany candle. Do you not think, do they not know what their market value is? I'm pretty sure they know what they should be selling their candles for, compared to, Bath and Body Works and, the other folks and whatnot. They know how much it should be priced. And guess what else they also know? You guys, they also know what it should be priced based on where they're selling it, what state they're selling it in. They're not just randomly just putting it out there and say, oh, we're just going to, price this at $15 and we're going to sell it at $15 everywhere. I can guarantee you this candle. If I ask everybody, the next time you go into the store, I don't know where I got this, Walmart or Target or something, and you look at a Tuscany candle, and all of us are living in different states, I could guarantee you we all would drop down a different price for this same exact candle. It's going to cost something different in DC. It's going to cost something different in Georgia. It's going to cost something different in Alabama. It's going to be something different in New York. It's going to be something different in California. If you're walking around out here in the healthcare industry, putting yourself out there and not knowing what your market value is, that, my friend, is a problem. Because you're probably leaving money on the table. I've had people ask me, they're like, how in the world are your clients getting $30,000 annual salary increase, $40,000 annual salary increases, $20,000 annual salary increase. Just for the record, that my average is 20K annual salary increase is what my clients get. But I like to call them quantum leaps. And I call it a quantum leap because it's like, this is where they should have been, you know? So to me, I love it. It's like, great. But I'm also happy because I'm like, great. This is what you should have been getting paid. Right? So it's important to know what your market value is. You have a market value. If you didn't know you had a market value, well, congratulations. You just found out today. Yes, you have a market value. And when you know what it is and you know how to advocate for yourself in salary negotiations, I promise you, you won't bat an eye. I promise you, you won't bat an eye when you say your number. Okay, let's come over here. Hello, you guys. And for those of you who are hopping in, you're like, why is she looking at two different places? I'm over here on YouTube, y'all. So if Instagram, if y'all want to come over here to YouTube, come over here to YouTube. It's my same name if you're looking for me. Let's see. Let's see over here. Fly Girl Breepy said that is so correct, especially when those insurances are not filed correctly. She's talking about how I said how important our front end staff is. Like, you guys are so important to the overall revenue cycle process. I like to think of us as a LinkedIn chain. We're all linked in at different parts, from our front desk registration to our providers, to our billers, to our coders, to rev cycle, revenue integrity, our IT folks. We are all linked in together. We're all just as important. And when the ball drops at one point towards the beginning of the process, the whole revenue cycle process, our roller coaster ride, we all fall off. And it starts at the very beginning. Latoya said, I'm a phlebotomist and currently in my first semester of RN clinicals, and I have 24 years of healthcare experience, mostly patient care and unit clerk. What route would you recommend for someone like me? So you're a phlebotomist and you're in your first semester for RN clinical. So is your goal to ultimately be a nurse, or are you trying to pivot into health information management? I need a little more background. Okay. If you're trying to get to health information management, that, it's going to kind of take you away from the RN clinical. So I'm just like curious of, are you trying to stay on the clinical side, or are you trying to come over here with us with health IT and health information management? And some people also get confused about health information management. Like when I say like health information management, keep in mind that there's like a health information management is like the big umbrella, and then there's a lot of different departments like under it. Okay, we're not like all in the same department, but medical billing, medical coding, revenue cycle, revenue integrity falls under that. You're not going to get a degree, like a degree in revenue cycle management. If you're getting an associate's or a bachelor's and master's, more than likely it's going to be health information management, something of the sort, but it will qualify you to work in those kinds of positions. You're not going to see a bachelor's degree in medical billing, or a bachelor's degree in medical coding, or a bachelor's degree in revenue cycle. You get my drift, you guys? It's going to be like a bachelor's degree or associate's degree in health information management that will qualify you to work in those different positions. Okay, let's see. Michelle, you said, I'm an Epic end user as a patient service rep, no college degree, working on my Epic proficiency. Awesome. And Cadence, any advice on how to get an Epic analyst job if my job doesn't have any openings? Ooh, excuse me. You're going to have to look for job opportunities with companies that are willing to hire you prior to having that certification. Keep a lookout for job opportunities that I post on my job board. When I do come across those kind of job opportunities, I post them on there on the Health IT tab. Okay, so there are some companies that will hire you with the Epic proficiency. They also will hire you as well with the Epic super user status as well. So if you don't already have the Career Connect job board, if you don't already have that, make sure that you get that. And you just always keep your eye out on there to see if I post any job opportunities with companies that are willing to sponsor your EPIC certification. Okay, let me come over here to Instagram. Let's see. Trying to make sure I'm not skipping anything. Ooh, these are coming through so quick. Some of you guys have requested to join me. You guys want to come on the live on Instagram? You want to come on the live, or was that an accident? Golden Lecture, you said I'm in revenue integrity, but I need more money, but every job is wanting a coding certification. No, 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 no. Mm-mm. Mm-mm. Having a coding certification is not required to work in revenue integrity. More than likely, that has something to do with your job search strategy. I can almost guarantee you, I could pull up my job board. I think I probably have at least like 15 or 20 jobs currently posted on the revenue cycle tab, and a good bunch of them don't require a certification. You don't need a certification to work in revenue integrity. You don't. You don't. What I love the most, you guys, about working inside of the healthcare industry, like I swear, the decision to pursue a career in health information management was single-handedly one of the best career decisions that I made professionally and financially. The health information management industry, and surprisingly, you guys, also health IT, is one of the few industries that are willing to accept you with or without a degree, with or without certification, with or without experience. It's a matter of aligning yourself with the right job opportunities that matches with what you currently have to offer, and embedding into your career strategy eventually to, pick up the experience, get a degree if you want, and get a certification if you want. Not everybody wants that. For me personally, I didn't want to go the 4-year degree route. I didn't want to have a lot of money in student loan debt. I also didn't want to spend a lot of time in school, and I wanted to do something that I felt would be a valuable career path that would get me there quickly, if that makes sense. Like I didn't, I had my daughter when I was like 19. I was 19 when I had her, and I'm like, I need to get serious quick, and I need to make some good money quick. I moved out when I was 18, so I had my own apartment, I had my own car, I had my own bills and responsibilities, and I'm like, I can't do this. Back way, way, way back when what was that, 2013 or something like that, I was making $20 an hour when I had a few years under my belt. So when I have sessions with people and I see that they're making $20 an hour right now in 2024, I know that that is not a living wage in the United States of America. It is not. Okay, it's like, no, and we need to be making more money. So when I'm speaking with someone who does have the years of experience, who does have the certification or the degree or whatnot, and it's 2024, and that is the salary range that they're making, I'm like, your next job opportunity and your salary increase is like this close to you. But you have to have a job search strategy in order, and you also have to have a resume that is working for you. Like, you have to have a resume that's working for you, because it doesn't matter how much you desire to get into your next position. If your resume is not opening doors for you, it's just keeping them closed. And, some people are blaming the industry and saying, I need a degree, I need certification, I need this and I need that. And I'm like, no, you need your resume fixed. You need your resume fixed, and you need to know where to look for job opportunities, how to look for job opportunities, how to negotiate your salary, how to quantify your impact and what it is that you're doing, how to scale in your career. That's what you need, a strategy. These universities and whatnot, I hate to tell y'all, they want y'all to think that you need to spend 20, 30, 40 grand on a degree. Anybody that's an adult right now and in this live session, y'all do know that's just a part of the United States system to get us in the system with credit card debt and student loan debt. It's some of the easiest things that you can get as soon as you turn 18. Meanwhile, you have people making six figures and some millionaires and billionaires who don't even have a college degree. Okay. Okay. So that's why I make it a point when I do like post my clients' career wins and whatnot to tell you guys their backgrounds so that you can see the variety of backgrounds that with people getting these career wins. It's just like some of them got degrees and some of them don't. Some of them have certifications and some of them don't. What they all have in common is what? They got a strategy together. They got their resume together. That's what they all have in common after they come across my path. Now they got that stuff together. Before they didn't have it together. Those are some of the main things that will hold you back in your career is a jacked up resume and not having a strategy, being 100% transparent. Okay, let's see. Uh, Nancy used to have I have been a surgical coordinator at a New York City hospital for the past 7 years with a total of 16 years in the medical field. I feel bored in my current role and I'm currently studying business administration. Surgical coordinator for whatever kind of practice that is that you're a surgical coordinator for, you should look at some job opportunities in revenue integrity. You guys can also, or you can look at job opportunities in fraud, waste, and abuse in that particular department as well. Kai, you said, I have a question. How do you find out your market value? I have an RHIT, CCS, and a bachelor's with 8 years of coding experience and looking to pivot into a different position, too, that doesn't involve man. I think, are you saying like working with humans or man? I don't know. So when it comes to market value, I'm going to again say that this is kind of one of my frameworks and practices that is much too much to even say in a live session like this. We'd be here for like another 2 hours. But the gist of it is knowing how to research the statistical data that is provided by the Department of Labor on a state level, also a city level, and also a county level. Some companies have their salaries publicly posted, but people do not know how to find them. You probably saw a post that I put on my Instagram page not too long ago where I posted like federal government contractors' pay rates and how you can use that information to negotiate your salary. But besides that, all of the items that are listed inside of a job posting as far as like what their requirements are and what they're asking for. I'm trying to put my phone on the charger so you guys don't disappear over here on Instagram. But as far as like what they're asking for, as far as background and work experience, so degrees and certification, years of experience, the things that they have listed inside of the job description, how many of the boxes that they check off, whether or not they have transparent salary data. All of these things you have to take into account when you are determining your market value. Okay, that's a high level overview of that, but it's much more intricate, much more intricate details. Anybody inside of my program can tell it's a whole nother level to that. And then also not accepting the first salary offer that they offer you and knowing how to counter that offer as well. How to counter that offer as well. Let's see. Charlene, you said, could you please provide the link to your job board? I added my email, but haven't received it. Check to see if it's in your spam or promotions folder. Check to see if it's in your spam promotions folder. It might be there. Okay. Brianna J, you said, is there certain jobs we need to be applying for? It depends. There could be so many. And inside of my program, I have a list of 500 different job titles you can pursue. And then I have it broken down by the department and sector, right? What I would tell one person to pursue would be something different that I may tell the second person to pursue based on their background, experience, education, degrees. There's so many different things that you can do. So it's like, I really can't just say like one particular position that you should be applying for because there's so many different ones. What I will say is, when you identify what your unique career advantage is, that is what helps you to create a targeted version of your resume. With the targeted version of your resume, you should be using that to apply for targeted job opportunities, right? So I wouldn't recommend to be all over the place with your application submission. So for example, applying for medical coding positions, and then applying for medical billing positions, and then applying for revenue cycle positions, and then applying for health IT positions, all with the same exact version of your resume. And it's like, there's no way possible that that one version of your resume is targeted to all of these different career paths, especially if you weren't updating and like, changing words up or whatnot, and the keywords that you have inside of your resume, if you're not changing them up, there's no way possible your resume was targeted for all of these positions that you apply for. So you're just like wasting your time. Wasting your time. And I like to tell people, like, I much rather you spend time either learning how to target your resume, writing your resume yourself, learning how to do it and fixing it so that you can apply for the right job opportunities and actually get requests for interviews. That's the whole goal here, not to just randomly apply for different job opportunities. Not everybody is great with writing resumes. So it's just like, hey, if that's the case, if you're like, I'm not great at it, or I just don't have the time for it, then by all means, let someone else write your resume for you. Yes, I write resumes. Okay. So, if you're not great at it, you're like, you know what, I just don't want to go through all this work. I have a 75-point check system when it comes to writing resumes. And if you know yourself, like, I don't got no 75-point check system when I'm writing my resume, I just put anything together and like apply for a job. Your resume is probably not targeted. And one surefire way to know whether or not your resume is working for you or not is if, when you apply for positions, if you're getting selected for interviews or not. It's really simple. It's like, you don't even need a resume audit for somebody to tell you that there's something going wrong with your resume. Ideally, you should get back anywhere between 10 to 15% of return on requests for interviews. So if you apply for 100 targeted positions with a targeted version of your resume each month, 10 to 15 of those applications should result in a request for an interview. If it's 50, that should be maybe about 5 to 7 of them should result in a request for an interview. If this is not happening, there you have it. Your resume, something's wrong. Either your resume is not targeted or you're just completely applying for the wrong job opportunities. And until you fix that, you're probably going to keep facing the same issues. And if this has been happening to you for months, I'm telling you, it's like, you got to get your resume together and your job search strategy, because you could be applying for the perfect job opportunities with the wrong version of your resume, or have the right version of your resume, a very well-written resume, and applying to all the wrong job opportunities. Everything goes together like a LinkedIn chain, you guys. Okay. All right, let's see. Checking the questions. All right. And Kaya, you said, do you help with entry-level refresher resumes? Yes, I do. I do. If you go, you can send me a message, or if you go into the links in all of my social media pages, if you go into my bio section and click on the link for my website, it'll take you to my resume revamp page. Oh, and just so that you know, because I'm saying that, and I don't want nobody to go run and go directly to my resume revamp page, I am going to do a resume revamp sale on Friday. So if it is something that you're thinking about doing, I recommend waiting. I recommend waiting until this Friday. Do you guys know, y'all gotta thank my daughter. I gotta thank my daughter. I had to have a conversation with her. I was like, so many people are asking me about running a resume revamp sale. Like, they thought that it was going to be a part of my pre-Black Friday sale. Congrats to everybody that was able to take advantage of my pre-Black Friday sale. I did that with 75 to 60% off, but that was for my other masterclasses that I have. So for Black Friday, the actual Black Friday, I'm going to do the resume revamps. And I had a conversation with my daughter, and I was like, do you think I should do it? She was like, do it. You should do it. I'm like, oh my gosh. So it was my daughter that convinced me to do it, you guys. I'm like, I never do a resume revamp sale for Black Friday. I've never did that for the last 4 years. Dina, you said, do you have any idea what the possibility is that they don't call me back since and then it cut off? Since you're what? Let me scroll down. Since you're disabled, no, I wouldn't say that. Actually, companies actually get tax breaks for hiring you. So, they actually have more of an incentive to, to hire you in. hmm They shouldn't do that. I can't really, speak to whether or not that would affect their decision. But what I do know is that they receive tax incentives and breaks or whatnot. So hopefully they don't do that. Kaya said, thanks, daughter. All right, let's come over here. Let's see. Quag, you said, I keep running into experience or certification problems. I'm not trying to work on a certification and school. Maybe I need to work on my strategy. Yeah, so when you're applying for different job opportunities, one, you guys remember to make sure to use my job board. And I really like the way I have it set up because it's like a high level overview. You can look at all the positions and just like read down the list and kind of like skimming, see which ones don't have any certifications mentioned. And I have all of the salaries listed right there. So you could just like zoom in on the one that you're interested in. And I always put whether or not they're asking for degrees and certifications on the job board. Besides that, when you are performing your job search on LinkedIn and Indeed, make sure that you put a dash and then remove whatever certification it is that you don't have. So let's say if it's the RHIT and you're looking for, let's say, revenue cycle coordinator, you do dash RHIT right next to it. That way, in the search results, you don't see anything in the search results that is asking for you to have the RHIT certification. Just remove it from the search results. Another thing is that you guys have to start doing is don't just rely on LinkedIn and Indeed and also Google Jobs or Monster Jobs or whatever it is that you're using. Don't just solely depend on these job search boards, not even my own, to look for job opportunities, because not every company posts their jobs on LinkedIn and Indeed. It costs them additional money to do that. And a lot of healthcare organizations, especially hospitals, have their own career boards. They have their own applicant tracking systems. They really do not need to post their jobs on Indeed and LinkedIn at all. So if you are not looking for job opportunities directly on hospitals, job boards on their websites, you're probably missing out on hundreds of job opportunities. If you've ever looked at something that I posted and was like, where the heck did she find that one at? I didn't find it on Indeed and LinkedIn. I know which hospitals to look at. I don't just solely depend on LinkedIn and Indeed. And if you only depend on LinkedIn and Indeed, you're going to feel like there's not a lot of job opportunities because they're not all posted there. Okay, companies have their own career boards. They have their own applicant tracking systems. They don't need to use LinkedIn and Indeed at all. They don't need to pay that extra money. Sometimes companies, they'll post a job on LinkedIn and Indeed and finish the recruitment process and all that, and they still have it sitting over there on Indeed, and people still applying for the job. Meanwhile, they're not even recruiting for it anymore, which is one of the reasons why, when it comes to job search strategy, why I say don't apply to jobs that's been posted for longer than 7 to 14 days. Don't. Because companies, ideally, they're trying to get their positions filled as quickly as possible. As quickly as possible. So when someone or when a company posts a job, and once they get a good amount of candidates, they usually take it down, especially on their own career board. They take it down. They select the candidates that they're going to send over to the manager for the manager to go through the applications. And then the manager is going to pick about maybe like 5 to 10 people that's actually going to get the interview. They get that done expeditiously. Okay. And being 100% transparent, when I post jobs, if you guys notice, it does not take long for the company to take the position down, to take the link down, because there's a flood of applications that they're getting. If I post a job lead on my social media page, then more than likely it went out on my email, my LinkedIn, my YouTube, Facebook, TikTok. It went everywhere. They get flooded with applications. Okay, they I know they're like, woo, I don't know who this girl is, but we like that she put that. I'm actually making it easier for some recruiters. And I don't get paid for that. I don't get compensated for posting job leads. I don't ask companies to pay me to post job leads. I just do it because I'm trying to expose you guys to different job opportunities inside of the healthcare industry and the amount of money that you can make in different positions. So this is just something that I just do. And when I post these jobs, please believe you are getting people who are qualified and unqualified to apply for the position. And once they get about like 300 applications, they take it down. They no longer need to put it up. They take it down. The ones that made it through the ATS, those are the ones that's going to go to the recruiter for the recruiter to look at. The recruiter is going to take another look and decide which ones need to go to the manager. And then the manager is going to decide who they want to call in for an interview. When people apply for jobs, you guys, 75% of applications that are submitted don't even make it through the ATS system. Don't make it through the ATS system because somebody is using an untargeted version of their resume. Or it was like no strategy. They just applied to the position. So 75% of the people that apply for the job, it didn't even make it through the system. The other 25% who actually did do some targeting, their resume is going to make it through. And the ones who really, really targeted their resume, really spoke to the pain points, the challenges of working in the position, really knew how to touch on those pain points, those are going to be the ones that the hiring manager is going to say, these are the ones we're calling in for the interview. And I can guarantee, and I'm sorry to say this, but it takes a little work. It takes a little bit of work to do that. And the majority of people don't want to do that. So if you are in the bucket of people who actually took some time to work on your resume or invested in career resources to work on your resume and got a strategy together, you're more than likely to be a part of that group of 25% of people who made it through the ATS system. And the ones who like really, really put it all together, you're more than likely to be a part of that 5% of people who get to the interview. I tell you right now, if I apply for a position, if I see a position that I want and I apply for it, I'm not even gonna say 9 times out of 10. I'm gonna say 9.8 times out of 10. I'm getting the interview. I will sit and target my resume for an hour before I apply for a position. I don't see if, and this is someone who is seasoned in the industry. Seasoned, been in the industry for 19 years. I have my associates, I have my RHIT. I still, when I look at a position, just randomly apply to it. No. Because if it's a position that I really want to get selected for an interview, if it's paying 6 figures, I'm going to take my time and make sure that my resume is targeted before I apply for that position. So if it takes me an hour to target my resume to that position before I apply, I'm going to take that hour. I'd rather take an hour targeting my resume for a 6-figure position than to spend an hour applying to 100 different job postings that I didn't target my resume for. I'm going for that job offer. So I'm definitely going to take my time to target my resume. This is what I recommend for anybody to do. Make sure that your resume is targeted for positions that you're trying to get the interview for. Loretta, you said, hello, is the HIT program supposed to be super challenging? I'm in an HIT program and it's lots of research and homework. I mean, that could be subjective, right? One person could say it's not challenging, another person could say it is challenging. So it really just depends on the individual. It really depends on the individual. Honestly, y'all, after I finished my program, I didn't remember nothing after I was done. Okay? They just be making us go to school, y'all. Go to school, pay this money for school to get the certification. I mean, it was good, valuable information, but I don't remember nothing for school. I just breezed through. School. Like, let me hurry up and get this degree and get this certification so I can start getting paid. just do good. Just make sure you get a C and above, Loretta. Okay. You're welcome, Charlene. Brianna J, you said, I want to learn how to make my salary go up with my skills. I'm making these companies millions doing their billing. Sometimes it could just be, and when I say leave the company, I'm not telling nobody to quit their job. Don't be going out here saying, Valerie said, quit my job. You line up another job before you quit your job. Okay. It might mean leaving the company that you are with and going somewhere else. A term I like to use is, take the meat and leave the bones behind. We're going to take the meat and leave the bones. Say it with me. take the meat and we're going to leave the bones. Take all that valuable experience that you have and take it elsewhere. Quantify your impact. Make sure you have that information listed in your resume so that when you apply for job opportunities with the next company that is going to pay you what you're worth, they'll be more, more likely to pay you what it is that you want. Let me look over here. For you guys looking over here, it's like, why is she looking over here? It's because I'm live on YouTube as well. So if you want to hop over here on YouTube, you can. You said, DNA, you said I got my associates with a 4.0 and a bachelor's degree, but nothing. Remember, you guys, it's not necessarily the degrees and the certifications and whatnot that's going to get you the job offer. Because you could get a job offer in the healthcare industry with nothing. Right? Now, that's valuable that you have that. And now it's time to put that degree to work. All right? Another one of the things I love to say is that you didn't put all this time, effort, and energy, blood, sweat, and tears into leaving valuable, relevant coursework sitting on your college transcript. No, we're not going to do that. Not after we paid a few grand for that. Not after that. We got to put this valuable information on your resume. And we also have to make sure that we're applying for the right job opportunities with the right companies. Okay, because not all companies value the education, but there are some that do. Those are the ones who are your target companies. You have to get a strategy in place and a strategy that aligns with you, right? You guys probably have already heard me say this, that what I may tell one person may be totally different for another person because, you're not the same. I can't tell everyone to do the same exact thing. We're all different. We all have different strategies, which is why step one in the HRM blueprint for success is identifying what your unique career advantage is. That's the foundation. Then you write your targeted resume. Then you create a strategic job search strategy that aligns with that. Where a lot of people are making a mistake is that they're starting at step 3, which is looking for a job. It's like, wait a minute. How are we at step 3 when we didn't do step 1 and 2 yet? Right? You got to put it all in together. Step 1 is your unique career advantage. Step 2 is a targeted resume. Step 3 is a strategic job search strategy. Step 4 is your interviewing strategy. Step 5 is your salary negotiation strategy. And step 6 is career scaling, in that order. A lot of people are starting at step 3. And that is the problem. It's a part of the problem. And it's so easy to fix. It's easy to fix if you're willing to receive the information. If you're willing to receive the information. Stephanie, you said, if you like criminal investigation shows, try to see HIT as being part of an investigation unit, but hunting for compliance, correct coding, and law and policies as tools to catch the killer. Yes. Oh, I hope Instagram don't filter me on that because I said that. You are 100% right. One of the analogies or examples that I like to give about revenue integrity. As you guys know, revenue integrity is my jam. That is my jam. But I like to refer to us as like the net at the bottom of the roller coaster, right? Because remember, I told you guys we're a LinkedIn chain and we have the roller coaster ride that we're all on, starting at the beginning with the front end of the revenue cycle process. My hair keep messing up. The front end of the revenue cycle process. That's the roller coaster that the patient gets on. That's where it starts, right? We're doing like this. And we have our revenue integrity folks, and I also like to refer to us as the revenue police. We are the people who are in between catching revenue leakage, right? So things that are dropping on the ride, catching revenue leakage, and we are looking for additional opportunities to bill for things, right? We're looking for additional revenue as well. And when we do find things that are going wrong in a particular department, we're trying to figure out the root of it, right? Is it a system issue? Do we have something going on with our system, with IT? Okay. Is it a provider issue with clinical documentation? Is the providers not doing something on their end? Are they not clicking on something in the medical record that triggers something else to happen in the system, and this is why the charge is not dropping, right? Is it something where it's a staff problem, right? So our coders or billers, like, is somebody doing something wrong? And is this the reason why we have this revenue leakage, right? Or is this the reason why we're missing out on additional opportunities to bill because the department is not aware of this new procedure or rule or regulation that CMS has implemented that now allows for them to bill for this particular item in this procedure, right? And then we're missing out on an extra $1,500 each time this provider did this procedure here, right? I'm just throwing out something as an example, but revenue integrity, we are looking for revenue leakage, and we are looking for additional opportunities to bill for things. It is a position that I feel like is rewarding because we're always finding things. It's always something, can never be nothing. That's what I say. Always something, can never be nothing. And usually these are things that make your manager very happy, also the department very happy, and the providers very happy because you're finding the money. Okay. So I absolutely love revenue integrity. And when I got into revenue integrity, one of the positions I got into was a revenue integrity coding analyst on the inpatient side. And this is one of the areas where people told me that, you can't work on the inpatient coding side unless, you've been a coder. And I've never been a coder. I don't have, the CCS or the CPC. I've never been in a medical coding position. I leverage my UCA, you guys, for those of you who do not know, my UCA is my expertise in denials analysis. That has been the one thing, the one skill set that has helped me to scale in my career from having no experience to being an auditor and working in revenue integrity. Now, I have many skills, but that has been the one thing that I've always highlighted about myself in my resume, also in my salary negotiations, promotions. This has been the one skill single-handedly that made hiring managers see stars in their eyes when I talk about the possibilities of what I can do. And I made my way into a revenue integrity coding analyst position on the inpatient side, and I was auditing medical coders. Meanwhile, I never was a medical coder. Okay, how did I do that? A targeted resume and strategy. The things that I have been able to do, I teach other people how to do the same thing. Okay. Charlene, you said my resume has been rewritten and still nothing. I've been in healthcare for 20 years and revenue cycle for 7 years. I've been trying to pivot into analyst roles with no success. So what I will say is, what kind of job opportunities have you been applying for, right? Are you applying for the right job opportunities with the right version of your resume? And then also, before you're applying for jobs, are you doing the keyword targeting part? Are you targeting your resume? That part that I was just talking about. I'm not sure when you wrote that, if it was like before or after I said what I said, but I have worked in the healthcare industry for 19 years. And I still would take like an hour targeting my resume before I apply to a position, even with all the years of experience that I have. Because what one position is looking for, one hiring manager is looking for in a position may be totally different from a different position. And you may not want to use the same exact version of your resume. There might be something different that you have to say, or there might be like additional keywords that were inside of a job posting that you may not have in the current version of your resume that you need to put in there. And being as though you have 20 years of experience, I have 19 years of experience. All of us in here have different, various years of experience. Just think about it. Your resume more than likely does not fully state everything that you did. That's impossible. If my resume stated everything that I did over the last 19 years, like I don't even know how long it would be. But it's a good thing to have so much experience, because that means that I could change my resume up as much as I need to, and maybe add in something that's not in the current version of my resume. I might need to go in there and change something up a bit, because I could just go into my inventory of everything that I did and just add it into my resume, right? But in order to do that, to catch that you have to do that, you have to be reading through job descriptions for understanding, and to go in and update and change your resume as needed. You may not always have to do this, but you may absolutely have to do that. I'm sorry, you guys, but it is 2024 and we have AI in our way. The way that we used to apply for jobs is no longer the same. My folks who are using 1-page resumes, 2-page resumes, and you have 5, 10 years of experience, or you worked in like 3, 4, 5 jobs and your resume is 1 or 2 pages long, well, if you fall in the bucket of people who's not getting selected for interviews, I'm telling you, it's a part of the problem. It's 2024 and we have companies who are using AI. They're using systems to scan through your resume. So if you're someone, Charlene, I'm going to use me and you as an example. You have 20 years of experience. I have 19 years of experience. Let's just say your resume is 2 pages long and my resume is 7 pages long. And let's say we have the same similar background experience. You have an associate, I have an associate, you have RHIT, I have RHIT, but my resume was much more detailed and I use much more keywords. And I touched on each one of the bullet points inside of the job description. And I knew exactly how to speak to the pain points and challenges of working in the position. And I went in like with detail. And my resume made it through the ATS system. And when the hiring manager saw my resume, she was like, oh my goodness. Schedule Valerie for the interview. Meanwhile, your resume didn't make it through the system. And it's not because you're not qualified. Not because you're not qualified. It's because your resume was short. What? Imagine that. Imagine not being selected for interviews because your resume. For positions you qualify for. And you have this thing called the ATS, the applicant tracking system, that is scanning your resume. And so when I tell you guys this stuff, I'm like, it's not you. Like for some of you, it's not you. Some people, it may be a little harder because you don't have the work experience or degree of certification. You're really, really, really trying to get your foot in the door, right? But for quite a few of us here, that's not the case. We do have experience. We do have a degree. We do have a certification. And you probably are applying for jobs. And you're probably like, why the heck am I not getting selected for interviews? Your resume could be a roadblock resume. It's a real thing. It's a real thing. So when I break it down to you like that, I hope it makes like a little more sense of how important your resume is to this entire process. There are some people who should be in different positions making more money, but they're not because of their resume and because they don't have a career strategy and they don't have a job search strategy. It all ties in together. It could be because you're not interviewing well. Some of my folks, you're probably getting to an interview, but you're bombing the interview, right? Or you're getting the interview, you're getting the job offer, you're accepting the first thing that comes to you, right? You're not negotiating your salary because you don't know what your market value is. So you ended up accepting, $30 an hour when you really could have negotiated for 38. With concrete evidence, right? Because when you're asking for more money, you don't just want to ask for more money because you want to ask for more money. You want to back up what it is that you're asking for. All right. Quay said, thanks, daughter. All right. Let's see. I went over a little bit, you guys. I said I was going to be on here for an hour. I get to talking. Let's see. Oh, I'm going to answer a couple more questions, then I'm going to hop off, you guys, so that I can figure out what's for dinner tonight. Let's see. DNA said, I'm going to hit you up for my resume. All right. I will see you. Okay, you guys, I'm going to come over here onto YouTube. Let me come over here. S. Bay, you said, thank you for your time. If you get burnt out from medical coding, revenue integrity could be a better alternative. I know. Oh, okay. I think you were just saying that. Okay. Okay, I think I asked for that. Melissa Porty said, I have my bachelor's in HIM, but only have 14 years of experience as a farm tech. What is the best avenue for entry-level positions? Have not taken the RHIA yet. You don't need the RHIA. Like when I say you don't need the RHIA, I'm saying that isn't stopping you from going ahead and pursuing the position. So you can put RHIA eligible on your resume. Anybody who is eligible to take a certification exam, but you have not yet, put eligible on your resume. Okay. This is valuable to the companies who would be interested in hiring you before you're certified. For the companies that absolutely do want you to have the certification, they don't care about that eligible. They want you to have it. But what I would say is look for revenue cycle opportunities in the pharmaceutical space. I also, when I look for entry level positions, you have 14 years of experience. We're gonna make a smooth pivot right over. We're gonna make a smooth pivot right over into the mid level position. Okay, it's not gonna be like senior level or whatnot, but with that bachelor's degree and 14 years of experience, we're not doing entry level. Entry level what? Okay, if we was in the session, I'll be like, Melissa, you said what? No, we're absolutely not doing entry level. Okay, so mid level, look for revenue cycle opportunities in the pharmaceutical space. Put RHIA eligible. If you've completed or if you got your authorization to test, put eligible on your resume. Or if I write your resume, I would do it. Okay, let's see. Oh, you said you asked my question before you read it. Okay. Let's come down here to the uh Anna, you said, do you have any specialized revenue integrity coaching? You're new to revenue integrity. This is something that I'm actually looking into. Okay. I did look into me creating some programs that will allow you guys to get CEUs. And I'm just researching whatever I, connected with AHEMA to see what the requirements are. And I already meet the requirements to do that. I would have to put together a program or a course, and it has to be like an hour long at minimum. And then I would have to submit it to them for review and approval. So if and when that happens, I for sure will let you guys know how you can take advantage of that. Okay. All right. So that was the last question. I said I did too. Let me stop because I'll be sitting here for another hour, and then my family gonna be looking at me like, "Woman, we need to eat." Okay, it's time for dinner. So I really love connecting and chatting with you guys. I love doing these Q&As every now and then when I can hop on. I had some extra time today. So make sure that you are on the lookout for my emails. I am going to do actual Black Friday sale. Some of you had access to the early access Black Friday sale last week, but I'm going to do another one on Friday. The resume revamps will be a part of it. I am going to have to limit it though, because you guys are working with me, okay? Like, whoo, okay, I don't have a team of resume writers. It's me. And there's only but so much I could take in. So I am going to have a number to that. I am going to have a number to that. So make sure that you are on the lookout for that. For those of you who do not have access to my free remote job board, make sure that you grab that, okay? Because like I said, I list all of the positions there. I list the salary amounts that they're offering, and I also list their requirements as far as what they're looking for, education and certification wise. I have that listed on there, and I make updates to it weekly. Okay. So make sure that you are keeping a lookout for that. Remember, when I post a job lead, they usually get a bunch of applications that very same day. And I don't know what happened. I went from getting like 300 likes on a post to like 5,000, 6,000, 8,000. I'm like, oh my goodness. They're probably like, oh my God, how we get so many applicants in like an hour? So just keep that in mind, you guys. Okay. So make sure you have your post notifications on too. That's another thing. Because I've had people that would find my post and they're like, I don't see the position posted anymore. And I'm like, I made this post on social media like 2 weeks ago. You just found it. So early bird get the worm, you guys. So make sure that you turn post notifications on for my social media pages like YouTube and Instagram, and also LinkedIn. And as far as my emails, make sure that you like star it or save me as a contact in your email inbox. That way it's not going to your spam or promotions folder. Because if not, it's going to get buried and you're going to see something a week later that you qualify for. No, we can't have that now, can we? All right, you guys. Good night. And thank you so much for chiming in with me. Bye.